Hi, I'm Robin Elkin. I'm a pediatric occupational therapist, and I specialize in working with infants who have reflux, sleeping problems, and feeding issues. I'm here today to tell you about the Rescue Infant Wedge. The genesis of the Rescue Infant Wedge came from an experience with my son who had severe reflux as an infant. I also had experience in the NICU with other reflux wedges that had other problems, and with Dr. Troop, an anesthesiologist, and his wife, Rosalind, a registered dietitian. The three of us together created a brand new wedge that has a unique design, and today we're here to tell you about it.
I developed a foam positioner to aid in airway management of the obese and morbidly obese patient. This positioner is called the Elevation Pillow. Robin and I work at the same medical facility, and she heard about the Elevation Pillow and approached me to see if I could help both create and manufacture an infant positioner. She was hoping to make improvements over the simple triangular-shaped positioner that she was currently using in her practice. Robin, myself, and my wife Rosalind Troop, who is a dietitian by training, put our thoughts and our ideas together to create the Rescue Infant Wedge. This positioner is an aid to manage reflux, ear problems due to congestion, and sleep disturbances. Hence the letters RES. The Q stands for quick relief, and thus this is the genesis of the name Rescue Infant Wedge.
We're going to talk about how to achieve the best use of the Rescue Wedge in the prone or tummy lying position. The first thing we're going to look at is how the sling fits on the baby. You want to make sure that the sling fits like a diaper on the baby, that it's not too high up under the baby's arms, and that you can fit 2 fingers in between the sling and the baby. The second thing you want to look at is how the sling fits on the wedge, and it raises and lowers up and down the incline of the wedge. The baby's head should be 2 to 3 inches from the top of the edge of the wedge. The baby's shoulders are going to fall gently forward. Now we're going to switch to the supine, or the back side of the wedge. This is the side that has the nest in it. This is also our large sling, and sometimes it can be large on your baby. So I'm going to teach you how to modify the sling. You're going to take the middle flap and fold it down, just like a diaper. You're going to take the side flap, meet it in the middle, and the other side flap. Then you're going to find the metal fasteners with the horizontal flap and gently fasten it. Here's our baby. You also want to make sure that your baby's bottom is sitting at the bottom of our nest. This is our nest. Some of your babies will fit right in the nest, and some of them, their head will come right outside the nest. Every baby is going to fit on this side of the wedge differently. If your baby's head comes outside of the nest, you want to make sure that your baby's airway is open. One way you can achieve that is by using a washcloth. You want to make sure that the diameter of your washcloth is about 2 inches. I'm going to show you the side of our baby. You're going to take your washcloth or neck roll and place it behind the baby, between the neck and the shoulder blades, so that they're in a neutral position. Neutral means their neck is open and they're breathing freely. Their neck is not flexed forward. If your baby's head tilts to the side, you may put a neck roll or a washcloth on the side, on either side of your baby's neck as well. If your baby's head is still coming forward or flexed forward, you may also use a pillow or a blanket at the base of the wedge and raise it up about 3 to 3.5 inches. The Rescue Infant Wedge is reversible. Here we have a pretend baby who is lying in a tummy or prone position. I'm going to take this baby off and show you that by flipping the rescue wedge over, you can now place a baby in a back-lying position by adhering the sling back onto the wedge. There are several ways to get your baby settled in the rescue wedge. Not all babies settle right away. One of the things that you can do is stay by your baby for the first few times you put your baby in the rescue wedge until your baby falls asleep. Secondly, you can use a pacifier. The pacifier helps with oxygenation. Another thing that you can do is use a soft cloth. This is a cuddle doll. You can use a soft cloth and put it inside your bra so that it picks up the scent. And you can leave a soft cloth with your baby so that the baby can smell you when you're away. The other thing that you can do is swaddle your baby for containment to your sling. Lastly, you can pat your baby on the back gently. This will help your baby fall asleep while your baby's on the rescue wedge.